Do you know what the Death with Dignity law is or why it's such a controversial topic? The Death with Dignity law took place in 1997 in the state of Oregon. The law allows patients that have a terminal illness to end their life. The physicians will give the patient a lethal medication if the patient has requested it. In 1997, the number of people that use this medication was 24. Since then, it has gradually increased every year, making it to 122 in year 2003. This law is gradually helping people take control of their own terminal illness and causing less pain. Originally, when I planned on starting college, I had looked into becoming a doctor. While I was exploring the profession, I came across some laws that doctors deal with. The Death with Dignity law was one that really stuck out. Since 1997, the Death with Dignity law has helped many people, and it can continue to do so. The Death with Dignity law is advantageous. I'm going to tell you about 3 points. 1, patients should have the right to die peacefully. 2, patients should have this choice without penalty. And 3, patients should have reasonable access to this medication. So, why don't people agree with the Death with Dignity law? They say that this is a form of murder because the doctor is killing the patient. Well, if that's how they see it, maybe they should try looking at it in a different way. The patient is the one requesting the medication, not the doctor. This law is helping these patients. Patients should have the right to die peacefully. This is my first point. On the Oregon.gov website, they have annual reports from each year since the law has been in place. These reports show how many patients have used this technique of dying. Each year, the number of patients using this technique goes up. Just last year, the number of patients that had taken the medication was 155. The number that had passed away is 105. This shows that not everybody that takes the medication will pass away. From a 2005 article written by Pamela Miller, it published in the Journal of Social Work in End of Life and Palliative Care, 208 patients use the Death with Dignity law as a way to end their lives. The people who use this law tend to be more highly educated, have cancer, most of them have AIDS, and they are the ones that have died during this period. 86% of the patients were enrolled in hospice. The reasons cited for choosing assisted death were loss of autonomy, less ability to engage in activities that make life enjoyable, and loss of dignity. As I argued in my first main point, patients should have the right to die peacefully. With the reports from every year since 1997, it shows how many people have used this technique as a way to end their lives. They didn't choose to just because. They had reasons behind their choices, and the Death with Dignity law is helping them to die peacefully. Since this law is helping many people to be remembered as they were before they decreased from their illness, it should continue to be legal. The court was upheld in the Gonzalez vs. Oregon case. My second point is patients should have this choice without penalty. In an academic journal written in 2006, it talked about the Gonzalez vs. Oregon case. This case, in summary, was about the state's right to define appropriate medical practice. What was actually presented in the court pits a state's right to regulate the practice of medicine against the federal government's right to regulate the drug. The federal side claims that because the drug used in Oregon to accomplish these deaths falls into the category of controlled substances, they have no final say over the legality of its use. Oregon claims that the federal government can only address illegal issues of regulated drugs, and that the doctors writing this prescription have the authority to prescribe the drug for medical purposes. An attorney general has said that physicians and pharmacists should be punished for writing and filing narcotic prescriptions used to end the life of a terminally ill person, even though these acts were kept under the Death with Dignity law. If the physicians were following this law, they cannot be punished. The law protects them for this practice. So in my second main point, I argued that patients should have this choice without penalty. As you can see, the law has been challenged and courts upheld it. The reasons they have upheld the law were reasonable, and the law should continue to be in place. So the law was upheld in this court case, and some people still don't understand it. In an article that talks about the Gonzalez v. Oregon case, citizens stated that if they let the state kill these terminally ill people, what is going to stop them from killing just the handicapped, the old, and the mentally ill? Well, the medication isn't easy to get by any means. This means that it's in the right hands and only prescribed to the people that can actually benefit from it. My third point is patients should have reasonable access to the medication. On the Oregon State website, you can find the forms in which you would need to fill out as a patient or a physician. You can also find the administrative rules that the physicians must follow. In the administrative rules, there is a section labeled reporting. The physicians must follow this procedure in order for the action to be legal. The process is as follows. The physician must, within 7 days of writing the prescription for the medication, they have to send documentation to the state registrar, as a list of the documentation can be found on the website, along with the documentation within 10 days of a patient's ingestion of the medication. The physician must complete the Oregon Death with Dignity Act interview. The dispensing healthcare must fill out a pharmacy dispensing record form within 10 days of dispensing the medication as well. The article from in 2005 about a case of the Gonzalez v. Oregon states that 2 physicians must agree if the person is terminally ill, and the person must be capable of reasonable judgment. This shows that there is more than one person determining the results, and so you can't just kill anybody. The law also requires that the patients are given information on hospice, pain management, and all other options of the end-of-life care. Sometimes a licensed psychiatrist or psychologist are needed to do an evaluation of the patient. The patient must make 3 different requests for the prescription within 2 weeks apart from each other. They must self-administer the prescription themselves. As I argued in my third point, the patient should have reasonable access to this medication. So with these laws in place, you can see that it isn't easy to go through the process. Not anyone can choose this in a way that more than one physician has to do it. The Death with Dignity law is not a simple process, and it helps patients die with dignity. Isn't that what we all want? They upheld this in a court case, and people are trying to shoot it down. This shows that the law isn't that bad, and people should try to see the good side of it. So I've told you 3 reasons why the Death with Dignity law is good. The law helps patients with terminally ill keep their dignity. They get to remember it as they were before, happy and healthy. This law has been challenged through the court cases, and so it should continue to be legal because it was upheld. It's not an easy process to go through with, so it shows that you can't just show anybody, or you can't just kill anybody. So my 3 main points were: first, patients should have the right to die peacefully. Second, patients should have this choice without penalty. And third, patients should have reasonable access to this medication. The Death with Dignity law is advantageous.